Good morning and welcome back to Morning at NTV. My name is Idris Matusegawa, and right about now we have entered our Tech Note segment where we talk about issues that affect you, your community, yourself and the country at large. Now today we are going to talk about something really very crucial: understanding IUDs as a family planning method. And in studio I have Dr. Milton Awudo from Maristops, who is the Technical Medical Services Director there. Doctor, good morning.
Morning. So,
how was the journey today here?
It was fine.
Any challenges with fuel?
Yeah, a bit, but it's, manageable.
It's manageable.
Yeah, it's manageable.
Well, Doctor, first tell us about Maristops. What are some of the services that you as a company provide?
Yeah, Maristops provides actually almost all medical services.
Yes.
Because Maristops, as an organization, have what we call channels where we provide services. And we provide them in layers, sort of.
Yeah.
For people who cannot afford, there's what we call outreach services, where the team goes to a government facility deep and provide family planning services after mobilizing them. Then for those who can afford something, they work with some private providers so that you can pay a small fee. And then you get your family planning services.
Yes.
And then Maristops also provides social marketing products. You know, the biggest brand of condom, Lifeguard, is what Maristops provides. By the way, they have now even improved, and there's a premium Lifeguard. Yes,
okay.
For people like you.
All right.
Yes.
So,
and Maristops has also a hospital now.
Okay.
One of the best hospitals they have just launched, where you can have all the reproductive health services provided. They have clinics which run like any other clinic, but the focus is more on the reproductive health services.
Yes.
We provide family planning, we provide the cervical cancer screening, you can provide the post-abortion care, antenatal, just like any other treatment of malaria at a small fee. Yeah.
Well, brilliant. Now, today we are talking about something that probably the male species might not be familiar with, and that is the IUD.
Yes.
Just explain to us, what is it and what is its purpose?
Yeah, before even I come to IUD, I wanted what you said, male species may not be
familiar.
Yes. You know, I've been telling people family planning is for actually a couple. If a man is using family planning, he's using because there's a woman.
Yes.
And the woman will use IUD because there's a man.
There's a man involved.
Yes. The women who don't need men don't need any family planning.
True.
Yes. So men have to be involved in even a decision. Yes. So IUD is a sort for intrauterine device. But now to make it look more focal, you say intrauterine contraceptive device. The IUD now we are talking about is intrauterine contraceptive device.
Yes.
And the intrauterine means it is inside the uterus, inside the womb. This contraceptive device works when it is placed inside the womb. So IUD is a device which you put inside the womb of a woman, and it prevents the woman from getting pregnant. Yes, that is what an IUD is.
For clarity, the IUD does not protect against STDs.
No, it does not. Actually, for all family planning methods, you are supposed to be counseled and explained. And this is one of the explanations you give. Much as it will protect you from getting unwanted pregnancy, but it cannot protect you from getting STIs, like HIV, like ordinary STIs also. Yes.
Do UDIs cause discomfort when they are inserted?
Yes, it can actually cause some minimal discomfort, but for a short time. You know, it is something foreign which is going to be introduced into your body. Yeah. Just like injection, there's some discomfort. But the discomfort is for a short time. After that, it is normal. You don't have pain again. You don't have discomfort again. Yeah.
When and who is able to have this device inserted in themselves?
Yeah, according to the government policy, Minister of Health, there's a category of health workers who are supposed to insert IUD. Not everyone is supposed to insert.
Yes.
And this person who is supposed to insert IUD should undergo some training on how IUD is supposed to be inserted, on how a client who is supposed to get IUD is supposed to be counseled, how this client can be examined. There's what we call eligibility, to see whether this client is actually eligible for this IUD or she may not be eligible. So you will need that type of person to provide IUD to a client. But IUD can be provided to any woman who is in a reproductive age. Whether you are breastfeeding, whether you have not had a child, whether you have a child but you want to delay a bit, any woman can use IUD.
Okay.
Yeah.
And some people have concerned that the IUD might actually cause death. Because I think a few months ago, there was a story going about of a lady, unfortunately, who probably went for the same procedure and either died or had so many complications. Is that true?
No, IUD itself cannot cause death, because right from that's why I'm saying the person who is inserting must be trained. So this person will have to place the IUD in the correct position in the womb, and it remains there. It can actually remain there for up to 10 years.
Oh, wow.
Yeah. Until when you decide, no, I think I've used enough, let me have another child. But after 2 years, 1 year, 3, 5, 7, up to 10.
Yeah.
So the reason that it can actually cause death then does not apply, because people have used it even up to 10 years. But of course, there are certain issues that can come out, either in the process of inserting IUD, then someone can die.
Yeah.
But it's not the IUD which has killed. The process of inserting the IUD, you see,
is what causes the issue.
Yeah. It's not the IUD.
Which brings me to the question of what you talked about eligibility.
Yes.
What are some of the things that women should know before opting for this device?
Yeah, actually, even if women don't know, this trained person has a list, something like a checklist. Do you have this? Say no. Have you had this problem before? No. Do you experience such things? What are your health conditions? What health conditions do you have?
Yeah.
They take you through all those, and then they keep on ticking. Once they realize you are not eligible, they will actually tell you that no, much as you needed the IUD, but you are not eligible because you have this condition, which cannot allow. That's why if someone now decides to insert without going through all that process,
the checkup,
then you can actually end it in problem. You insert in someone who is not eligible, or you use the method for inserting which is not the correct one. Okay? So in that process now, you can actually cause death, but not the IUD itself. Yes.
Are there particular diseases that probably our viewers could point out and know that if I have this, if I have that, I can have this device inserted?
No, it is just like if a woman has cancer of the cervix, because the IUD is inserted through the cervix.
Yes.
So if there is already a disease condition there, you are not supposed to insert IUD. Or if someone has an active infection in the womb or in her private parts, you are not supposed to insert IUD at that time. You first have to treat the person first.
Yeah.
Or if a lady has some abnormalities in the womb, because since the IUD will be in the womb, if there are abnormalities like a very huge fibroids or something that happened to your womb and so on, it's not advisable actually to insert IUD. But other conditions, there is no contraindication for IUD.
Well,
Yeah.
if you have just joined us, we are talking about the IUD, a family planning option for women out there, and we're talking about the do's and don'ts and some misconceptions that have been passing around about the device and correcting those. And if you have any questions, please go to our Facebook or Twitter page and ask those questions. This is your chance to actually get some of the information that you might not have been privy to. Look out for NTV Uganda or myself, that is Idris Matusegawa, and answer the question or put there your views or questions to the doctor, who will be able to answer them and probably save a life. Now, coming back to you, doctor, the process of inserting the IUD, of course it involves undressing, etc. There are some women who have probably beliefs that they cannot undress before another man, and they find it uncomfortable. What solution is there for them?
You know, IUD is one of the what health workers consider as some of the intimate procedures.
Yes.
And they are very sensitive procedures. That's why a client has to go through counseling. And the health workers are also trained to seek the opinion of the provider. Say, I have given you this information. This is how we are going to provide this service to you. You are going to lie down. Maybe we are going to undress you. I'm the one going to do it for you. So do you have any problem me providing it to you? So if the client says, no, I would have preferred maybe a woman. Because in a health service facility, there is always someone who
an option.
Yes, there's also only option. You say, maybe staff so-and-so, please, can you come and you say, will you be comfortable with so-and-so? And say, yes, I think I'll be comfortable. Then this new person can now take over. And yes, and it is a procedure where you actually agree with the client, and the client consents to whatever you are going to do to her. And in some cases, if the client says no, whether it is my fellow lady, whether it is a man, I don't want to undress, then that is where now you say, then, because you cannot insert IUD if you have not yet undressed. So it means now the option of using IUD is now out. What
is the procedure like? Is it a surgery? Is it, how complicated is it?
No, it is not complicated, because there are equipments which are specifically for providing the IUD. So even the IUD itself comes with the parts which make the IUD insertion very, very simple. So, and it is what in medical terms we call it a sterile procedure. So the provider will make sure the client doesn't get any infection after the procedure. Yes, so the procedure involves using some small equipments, and then the IUD is introduced into the womb. Yeah, that is how it works.
You know, some concerns with the ladies is gain weight. Does the IUD cause gain weight?
IUD directly does not cause the gain weight. I mean weight gain, because you know, IUD is just like something which has been put in the womb. It doesn't have anything to do with the blood system, something in your system, adding something in your system, and so it is just there. That's why when you insert it today, it becomes something which has blocked someone from conceiving. And when you remove it immediately, this person can actually conceive immediately. So it doesn't have anything to do with weight gain. It doesn't have anything to do with maybe disappearing somewhere. You know, it is just...
The gain weighting is just...
No, maybe because because the majority of people who have used IUD, they feel that comfort. You know, IUD is what we call long-acting method. You can use it up to 12 years. So after using it like for a year or two, you are comfortable, you don't have any problem now thinking about am I going to get pregnant. So you are now living your life. So you can enjoy everything.
You're free to
you
eat.
Are free to eat. You are now no worries.
Yeah.
Then you gain weight. But it's not the IUD actually causing the weight gain.
It's yourself who's
It is
doing
yourself
all that.
now who is comfortable, and then you are now enjoying yourself.
How expensive is the procedure? Because, you know, those are some of the concerns that people have. They would probably, because the way you've explained it, it's safe, it's comfortable, it's something that can go long term. How expensive is it?
No, IUD, by the way, is not expensive. IUD, the device themselves, the contraceptives, are imported by government. And in government facilities, they are provided for free. You don't pay anything. You just go, they ask you which method you want. I want IUD. They take you through. Once you're eligible, they provide the service and you go. You don't pay anything. When you go to some private facilities, there's some small charge they put. But the charge is not even on IUD. The charge is on the things they use, the gloves, the things they sterilize, the medicine, and so on. IUD itself actually is not expensive.
So are there particular clinics and hospitals that you can only get this procedure done?
In all government hospitals, in all government health center 4s, most of health center 3s, some few health center 2s, there's IUD. You know, every health center has that privilege of asking for us, we are going to use this method. Then they ask, then NMS sends. So even in health center 2, when there's someone who can provide the services and they have asked, they provide it. NMS distributes those contraceptives up to the health center, and the providers will provide IUD. There is no specific place that IUD is only here. For in government facilities, in most of these health center 3, 4 hospital, few health center 2s, IUDs are there. And then in the private facilities, most of these big private facilities, hospitals, it is also there. And in NGO hospitals, NGOs like Maristops, like RHU, like PSI, because they are also reproductive health based NGOs. So in most of their facilities, you also get IUDs inserted.
What are some of the precautions that one must take before even thinking about the idea of having the device inserted in yourself? Because there are cases that you might find people thinking that I can do this myself. Are there some dangers to the device?
No, before you insert your own condition, maybe you say I have this, so I will not. No, it's only the conditions that they explained earlier. But of course, the health worker will still tell you. Even if you didn't want to tell him, he will ask you when he gets it. He'll tell you, no, you have this condition, so you cannot use IUD.
So this is something you can't do yourself?
No, you cannot.
That's a big emphasis.
You can't provide IUD to yourself, and you can't discontinue it yourself. You have to go to that trained health worker who is going to first advise, who is going to check, then he can provide. Then when you decide, I've used it enough, maybe even, by the way, you can even use it after, even for 1 month. You change your mind, you go back, you say, now I've changed my mind, I want now to use another one. Or the reason why I was using IUD now is no longer applicable. Now I think I want to get a pregnancy or child. Then you go to the health worker and they will remove it. And the health workers know among themselves. He will tell you, for me, I don't know, I'm not comfortable providing, but so and so is the one who provides. They can always refer you to someone who can provide it for you.
Well, doctor, just before I let you go, please, just a few words of maybe conclusive remarks on the issue.
Yes, IUD is actually a very good method. Very many people are using it, and we need to get that information clear to ladies and gentlemen so that they come and use IUD, because first of all, it is safe. Any type of woman can use it. And it is long-acting for people who want to delay their pregnancies for a long time. They can use it, and it is used by anyone, whether you are breastfeeding, whether you are fat, whether you are not had a child, whether you are small, whether you have some of these common diseases. You can still use IUD. Yes, and then for ladies who fear, maybe I don't want anyone to know that I'm using family. You know, there's some feeling, some people think, this is my own problem, I want it, I don't want anyone to know that I'm using. It is also a good method because it is only you and the provider who knows that
you have it.
So you can use it comfortably until when you have made your mind
ready?
Again to say, I'm now ready. Then you come and remove it.
Perfect. And maybe just to emphasize about the STDs, because some people might confuse that the IUD prevents HIV and other STDs.
Yes, that is one of the questions every health worker is supposed to explain. Much as you have used IUD, it will prevent you from getting pregnant, but it will not prevent you from getting STDs. The only method for family planning which can prevent both pregnancy and STD are condoms. And the UTI also. It cannot prevent, but the IUDs cannot cause UTI.
Yes.
That is one of the problems. People think maybe IUD, I get UTI because of IUD. No, because the body of the woman where you can get IUD is different from where UTI always affects. Because UTI is urinary tract infection. It manages the urinary tract system. But IUD is in a different system.
Yeah.
Yes.
Thank you so much, Dr. Milton Awudo, for this very informative talk. And if you have just joined us or missed our conversation, you can still go to our social media platforms, that is YouTube, Facebook, Twitter, and catch up. If you had some questions, probably we shall be able to get some answers for you. But share your thoughts, share your views, share your questions. We shall be right back with more on Morning at 10 TV.